existence since 2003, which is a little while. We've got one project which is called Bridging the, or From a Whisper to a Song, Bridging the Peer Collective Together. And the idea behind it is that we do radio broadcasts where we can engage the public as well, engage the public on what exactly is happening in the downtown east side with First Nations people. And as well, we do weekly peer support meetings at the Life Skills Center, which is a Vancouver Coastal Health Community Drop-In Center. So at those meetings, basically all of our activities are all driven towards keeping First Nations people safe. And we do it through education and awareness around HIV and hepatitis C. And in the downtown east side, there's roughly 19,000 injection drug users. A lot of First Nations people are in the downtown east side. I would even go as far to say is that First Nations people disproportionately are affected by poverty and by disease and by death. We run our weekly peer support meetings where we're able to tell members where the free food is, where they can access local services such as like the Health Contact Center or detox or needle distribution, all measures that are designed to keep drug users safe. And I wanted to maybe talk to you guys. This is my first time actually talking to a real political body, so or somewhat political body. So I wanted to actually mention a little bit about the 4 pillars and my understanding of it. In Vancouver, I arrived late on the scene. Philip Owen was already gone as mayor before I even showed up in town. But they had this group called the 4 Pillars Coalition, which in my mind is supposed to represent the continuum of services for people that are out on the street, eh? And just recently, I've gotten, like, I don't know if you guys are members of the coalition, but before the strike, we got a letter from, or a notice from Sam Sullivan saying that, talking about reconfiguring the 4 Pillars Coalition to actually to go along with this Civil City campaign, which is to reduce the amount of garbage on the street, to reduce the panhandlers, the people that are actually asking for money. So to me, it seems like the Civil City and the campaign that Sam Sullivan is pushing is really just an aesthetic band-aid, eh? It's meant to just make the problem look cleaner, eh? I mean, it's not really doing anything towards a solution. As a First Nations person, I really struggle. The organization that I work with struggles. They don't even have a home base. They've got one project. We've been doing work with the federal government, with the Public Health Agency for, we're going on our 4th year now. And there's no real formula or a model to say, how is it that our health initiatives like alley patrols, hospital visits, or policy things like the radio show, how is it that those services or those, I don't know, health promotions become an actual service? We're going on, like I said, we're going on 5-6 years now, and we have no support from the province. The federal government looks like, well, we've gotten notice that they're cutting the ACAP, or the AIDS Community Action Programs across the country. 38% of the funding was cut in Ontario already. And like our health minister, Tony Clement, has been quoted as saying the party's over for drug users, eh? If he's been to Vancouver, he would realize that it's no party, eh, out here. I mean, even the way that societies are formed, the way that they carry out their work, really isn't because the government is committed to ending a problem. It's really, societies are formed because there's individuals that really care about what's going on, and enough bad stuff happened that they got up and said, well, let's do something about it, right? So I think we've got a real large battle actually to actually convincing the federal government that we're not expendable, and that we need to really support policies that don't result in the death of people. Take for example the First Nations people and Aboriginal youth, or has anybody heard if you've been poked by a rig that you can go to the hospital and get treatment? And that kind of exposure works for anything, right? If you've had unprotected sex and found out for the first time that you've been exposed to HIV, why can't you go get that treatment, eh? Right now, as it exists, the employer pays for it if you've been poked with a needle. But what I'm saying is, as a First Nations person, there's a lot of Aboriginal youth, and if they knew that the option was open to that, if they knew they were exposed to HIV, why couldn't they go to their doctor or to the hospital and say, hey, I've been exposed to HIV for the first time, eh? The treatment is excruciating and it's very expensive, but the alternative is death, right? So which one makes more economical sense? If one person gets HIV, it costs, I don't know, $350,000 to $450,000 per year for treatment. If you can give that person that therapy so that they don't have HIV, then you're saving a lot of money, eh? Just an economical question. And maybe encouraging COPE to get behind the science of harm reduction and not the ideology of the American war on drugs. They already know that the war on drugs doesn't work. Building more prisons in Canada isn't the option. Yeah, I've got a mental block there. But so a lot of our members, like I said, we run a weekly support meeting of 20 people per week at the Life Skills Center, and at any one of those meetings, over half of them are homeless every week. So we hear all kinds of things like the province is going to support shelters, the province is going to, or make sure that shelters keep open during the day so you don't have to leave at 6 o'clock in the morning. And that hasn't happened yet, eh? My brother is sleeping outside every night right now, eh? So I've got a friend there in the back, Audrey. So maybe Audrey, wave your hand if you're here. But I'd encourage everybody to sign her list to open Storium as a shelter. I used to actually run the Life Skills shelter at the nighttime shelter during the cold and wet weather. This year, since last year, they kept it open all year round as a women's shelter, so they're not able to open it for people out on the street, for men and women. So this year, the Life Skills Center isn't helping people get inside, and I'm just wondering, because people are still outside and I haven't heard about any cold and wet weather shelters opening, or that strategy starting. So my members are freezing, we don't have a home base. So I'm happy that we can work towards solutions. I think the number one solution that we could provide is an actual interface for First Nations people into the economy. We've got treaties nationwide for First Nations people, but we've got no governance for First Nations people in the cities. So nobody's really responsible for us, so nobody really cares. Eh? So I'm hoping that we can actually build business as the solution, eh? Because we all need resources. Thank you.
All right.